November 16, that's today, was supposed to be the deadline for states to decide if they would set up health exchanges as part of the Affordable Care Act or let the federal government do it for them. With 8 or so states still on the fence, last night the Obama administration extended that deadline for another month. Sarah Kliff from the WonkBlog covers healthcare and has been following all this. Sarah, what does this extension mean? Was it a surprise? Where do we go from here?
So the extension wasn't exactly a surprise. There's a letter from the Republican Governors Association on Wednesday where the governor said, look, we want more time to decide on this, that some of us were waiting until, after the election to see if the Obamacare law would survive. And HHS essentially said, yes, we're going to give you an extra month on this.
And what exactly are they deciding?
So they're deciding whether to set up a health insurance exchange, and it's pretty much, it's a new online marketplace. A lot of people have made comparisons to Travelocity or Expedia, where starting in 2014, you can go onto this website, click around, compare insurance plans, and essentially sign up for an insurance plan. And what they're deciding on right now is whether they're going to set up that marketplace or they're going to say, you know what, we don't want any part in this, federal government can set it up.
I think I'm still not 100% clear on who these exchanges are going to apply to. Who's using them?
So I think when I'd say you're totally in the majority right now, there was one survey recently that showed I think 78% of Americans have no idea what these are.
If you're going to be ignorant, do it with a crowd. That's my policy.
So the exchanges, they are, what's going to happen, let's back up a little bit. So the healthcare law is going to provide insurance subsidies to anyone who earns up to 400% of the poverty line. That's about somewhere in the $50,000 range for an individual. Your subsidies will depend on how much you earn. If you're earning at 200% of the poverty line, you're getting a lot more than someone at 400%. You're going to be able to use these subsidies on this insurance marketplace to buy a less expensive healthcare plan.
And we have a map that's going to show that the federal government will be doing this at least in some significant parts of the country, because there's a number of states that have already made clear they'll opt out. Talk us through this map.
Yeah, so what we're seeing is that a number of states with Republican governors, especially in the South, places like Texas and Florida and Alabama, they've said, no thanks, we're not interested in this. And I'd say Texas and Florida are very important. Together they have 10 million uninsured people, which is bigger than the entire state of New Jersey. So this is going to be a place where they're running really big insurance markets where they're going to have to do consumer assistance, they're going to have to do outreach. And what it means is essentially a much bigger task for the federal government in states that don't really like the healthcare law to start.
So December 16 is the new date for states to decide.
December 14th.
Oh, December 14th.
Yes.
So it's less than a month. It's a short
wrong.
month. Okay.
Yeah,
it's a month, but not a full calendar month.
Yes.
Do we think the Obama administration did this so they could kind of cajole these states, or why?
Yeah, I mean, there's a little bit of different thinking about it. One is to cajole states. One is, they legitimately needed more time. Some of them might have been waiting until after the election to figure out what was going to happen. Some other thinking I've heard is that it's essentially the Obama administration calling the governor's bluff, saying, you guys don't plan to do this. We're going to give you the extra time, but, we're being as flexible as we can. And it's time for you guys to kind of decide what you're going to do and kind of giving them exactly what they're asking for and seeing if, they're going to play ball.
Okay, December 14th.
Yes.
Thanks a lot.
Thank you.